The heart, and you can see above the heart right there, this big, are we doing veins or arteries, or are we going to do both?
Both, if possible.
Okay, well, we'll do veins first, and we'll do arteries.
Okay.
So here we are. This is the superior vena cava, right there. The superior vena cava is formed from the confluence, from the anastomosis of two brachiocephalic veins. These are the brachiocephalic veins here. They're real short, real short. The brachiocephalic veins are formed from the anastomosis of the external jugular vein and the subclavian vein. The subclavian vein in the armpit is actually called the axillary vein.
It's the same one, though? It just continues?
Same vein, same thing. And in the arm itself, it would be the brachial vein.
Okay.
Same vein, just different names because of different places. What you don't have here is I guess this is the internal jugular. It did not fill up with very much latex.
Okay.
But so in most cats it looks bigger than this, and on an exam I'll find a bigger one.
What is this bottom one then? We thought this was external and internal.
I don't know what this is. I don't know what that is. This is external right there.
Okay.
I don't know what that thing is.
So the internal branches off much sooner than...
Well, actually, anastomosis. So they come together. They don't branch off. Okay, this blood vessel right here, this is the subscapular vein. Subclavian vein, subscapular vein, axillary vein, brachial vein in the arm. Okay? And there's one more vein that we learn here in the upper part. This vein that enters the superior vena cava right before the superior vena cava enters the heart. That's the azygous vein. Azygous. It's singular. It's draining the elastic connective tissue of the lungs. It's draining the vertebrae. It's draining the back muscles. Okay? Okay. Arteries above the heart. This artery right here, this is the pulmonary trunk artery. There. The aorta is partially covered up with connective tissue, but it would come out it's right in there, and it would come out and bend around as an arch. That's the aortic arch.
Okay.
Giving off two branches. The first branch is the brachiocephalic trunk artery. The second branch is the left subclavian artery. The brachiocephalic trunk artery has three branches of its own. The first branches, and I'm going to try to separate things out here. You can see three branches. There's one branch right there. That's the left common carotid artery. Left subclavian artery. I'm sorry. There's the left subclavian artery. I'm sorry. It's the left common carotid artery. I'm mixed up, and I'm on tape at that. It's the left common carotid artery. There's the right common carotid artery, and the third one is the right subclavian artery. So those three branches come off the brachiocephalic trunk. The brachiocephalic trunk artery is the first branch off the aortic arch. The second branch off the aortic arch is the left subclavian artery. So the right subclavian artery is a branch off the brachiocephalic trunk. The left subclavian artery is a branch off the aorta. The aorta continues around. By the way, the arteries are just like the veins. The subclavian arteries, as they pass through the armpit, we call axillary arteries, and then as they enter the arm proper, we call them brachial arteries. And where you can see this subscapular vein coming from the subscapular region and the subscapularis muscle, the artery is heading down to it, and they run parallel. There's the artery right there. Okay. They're both going in that direction. The common carotid arteries, we saw them here, but up here in the neck, which is where I'll ask you, there's the left common carotid artery right there.
Couldn't even notice it. It's just like the same color.
Right, yeah, I know, it didn't fill with much latex. The right common carotid artery is right there. And then right between them, you have the trachea. There's the trachea, and you can see the cartilage rings there.
That's kind of cool, yeah.
And then right here, this is kind of oozed out from behind. This is the esophagus. This squishy thing, that's the esophagus that's squeezed out. It belongs down underneath and behind the trachea like that. Just kind of ooched out. Just, the dead cat effect. Okay?
Probably getting shoved in
well,
there.
Well, what I can do is take a sharp probe and move this over and stick a pin in there and say name the tube. You got to know it's esophagus.
Okay.
Are we good?
Yes.
Okay, on the heart itself you can see coronary arteries. Those are the pink ones. They don't show up real well, but the coronary veins do. Those are pretty good coronary veins there.
Would you just stick in the pin in the heart and say, what are these veins?
Name the blood vessels, yes.
The coronary.
Below the heart, there is, right here, is the inferior vena cava, and there's a lot of pericardial sac left here, but you can still see it. That's inferior vena cava right there. There's a lot of clotted blood, but that's the inferior vena cava.
Okay.
Good?
Yes.
Okay. Let's see. Let's do arteries down below first. The aorta comes out of the heart, bends around, and then you can see it heading down toward the diaphragm, just behind the lungs on the left side. It goes through the diaphragm, punches right through the diaphragm, and comes out right there. See it coming out?
Yeah.
The first branch is the celiac trunk artery. The second branch is the superior mesenteric artery. The third branch, and there are two of those, they're paired, are the renal arteries. There's one on each side, one going to each kidney. The fourth branch is singular. It's this one right here. It's the inferior mesenteric artery. And the aorta itself ends when you get down to the pelvis. It branches into two external iliac arteries. There's the one on the left, external iliac artery. Medial to that is, clean it a little bit, on both sides, is an internal iliac. There's the left internal iliac, there's the right internal iliac. Okay, the external iliac heads out into the leg as the femoral artery. And then it leaves the thigh area and heads down behind the knee as the popliteal artery. Right. The vein stuck to it, so I'll bring them both up. Here's the popliteal artery and the vein.
Okay.
Now, before it dives down in there, it gives off a little thin branch that you can kind of see right in there. That's called the saphenous artery. And when I forgot, there's a branch, there's an artery and a vein coming off right here. The vein is here, the artery I don't see. There's the stump of the artery right there, I guess. I can't tell. That's the proximal caudofemoral artery and vein here. I think those are all the arteries.
Awesome.
Okay, let's do the veins. Below the heart, we already saw the inferior